Today, beautiful Saturday in Brisbane. Okay, good morning Queensland, and good morning to all of our Facebook Live followers. So I'm joined today by Dr. Young and our Health Minister, and we want to give an update about that case that we spoke about yesterday. So I can report that we have 5 local cases and 3 overseas acquired. Now the good news is the 5 local cases are from the same family. So that is absolutely really good news, and Dr. Young will explain to you that we actually think we know the source of the infection. So I know there's a lot of concern out there at the moment amongst the community about is there a lockdown today? There is no lockdown today. But I will say this, over the next 48 hours we'll be closely monitoring the situation, and if we start seeing any seeding, then we may have to take very quick, fast action. But at the moment, it's contained to the family. We also have that young girls' school community. They've gone into home quarantine, about 1,000 people there, so we know that people are doing the right thing. But we absolutely need Queenslanders, if anyone has any symptoms whatsoever, to go and get tested. Now, this young girl had a headache and her mother took her to get tested. We also believe that the source of this cluster could be a visitor who came to the father's home from New South Wales. So we are doing further investigations there. So we believe we know at this stage the source of the virus. Now, we also need people to be very vigilant this weekend. And of course we know that another truck driver visited Mount Gravatt. Remember we talked about that the other day, the Mount Gravatt shopping centre. So Queensland, this is the time we need everyone to step up. If you are going into a shopping centre, you must wear your mask. If you are going into cafes and restaurants, you must check in. And I noticed I went to a cafe the other day and they checked that I was checking in. So if they're checking me, they're going to be checking you as well. So everyone, please do the right thing. And it's absolutely important we see testing. So if anyone has any symptoms, like this young girl who presented to her mother with a headache, please go and get tested. It is absolutely critical. So the next 48 hours will be a very close monitoring of this situation, and Dr. Young will go through a bit more details about that. So can I say too that in last 24 hours we've had 11,888 tests, and our vaccine rates are consistently very good, with 23,631 vaccines that have also happened in the past 24 hours. And of course we saw that Mount Warren hub that we looked at yesterday, that'll be taking bookings today, and Cairns Convention Centre is also taking people today as well. Now is the time, Queensland, to get vaccinated. We now have 55.4% of eligible Queenslanders who have their first dose, and 37.07% of eligible Queenslanders are now fully vaccinated. And as I said, if we get more supply, we will get more vaccines into people's arms. So there is a sense of urgency here, because we are seeing these clusters that pop up, and we need to make sure that we are protected as much as we possibly can. There are thousands and thousands of cases in New South Wales. It is just across our border, and we've seen how easy it is for it to get across our border, whether it's in a freight driver or a visitor from New South Wales. So that's why we have our tough border measures in place, but we can't stop everything. So we need Queenslanders to play their part, and I know that they absolutely will do that. I also just want to mention to people in the suburbs of around that Garden City area, that Mount Gravatt and Sunnybank and Maruka area, to please very much monitor your symptoms, just see if you've got any issues, and if you do have any symptoms, to go and get tested. And if you have visitors coming to your house this weekend and you live in those areas, and probably need to include the northern parts of Logan as well, because they travel to the Mount Gravatt shopping centre. If you're having extra visitors to your home this weekend, maybe take a list, just keep a list of who's coming in just in case anything happens. But I know Queenslanders are absolutely doing the right thing, and like I said, the next 24, 48 hours we will be closely monitoring that. Dr. Young will also be announcing some restrictions that are in place for aged care and our hospitals, just whilst we have that cluster that has been identified. But as I said, there is no lockdown at this stage. We are monitoring very closely over the next 24 to 48 hours, and we are very hopeful that we have been able to identify the source and get on top of this very, very quickly. And I really want to thank the parents, the mother who took her child to get tested, because to identify this so early has been a godsend. Okay, I'll hand over to Dr. Young. Thank you.
Thank you, Premier. It has indeed. Can I just commend that mother? So her daughter had a headache, and I'm a mother. I know my kids have, headaches and issues and all the rest of it. So to have immediately gone out and got her daughter tested, and her daughter's tested positive, to get that so quickly means we can respond by just asking people to do what they've been doing so well. So to wear your mask when you can't socially distance, to use those QR check-in codes, and, like this family, the slightest hint of a symptom, a sniffle, a headache, anything at all, to come forward and get tested. That's critical. So we now have all 5 members of that family positive across 2 households. So we know this is the Delta variant. I got that genome sequence back last night. It's not linked to the Indooroopilly outbreak, and it's not linked to our recent Beenleigh outbreak that we're still managing. The best that we can see is it's linked to cases in New South Wales. So then we went looking and talking, of course, and this has been a very, very helpful family. So the father who these children saw on Father's Day actually had a visitor from New South Wales stay with him overnight on Father's Day. So we're urgently working with our New South Wales colleagues, because this gentleman who was visiting has gone back to New South Wales to get him tested. But I think that's the most likely source for this outbreak with this family of 5. So the children and the father were exposed to this visitor from New South Wales, who we haven't tested yet. I just confirmed that. We don't have it, but I think it's the most likely source, so we're urgently getting that gentleman tested. Then those children have gone back to their mother, who lives in a separate household with the children, and the mother's become infected. So that 5 people infected. Now, the school, as you heard yesterday, immediately worked with us, and all those 1,000 families went into quarantine, and thank you to that school. They've been brilliant, and that whole school community. And the mother did go to work at the Nathan campus at Griffith University on Wednesday, but saw very few people. So we're quite comfortable there. Then we're just working through where the father works and exactly who needs to be contacted there. But because we've got this so early, we've got it in the first generation of cases, we've been able to bring all this together and manage it. I just need everyone now, particularly in that Mount Gravatt area, in that northern Logan area, southern Brisbane area, it's really, really important that if you have any symptoms whatsoever, you go and immediately get tested so we can find if we've had any further spread of this particular outbreak. And so we just need you to do that and work with us. And then for everyone else, please go and get vaccinated. We're seeing large numbers of people come through to all our vaccination clinics. clinics. It's really important. Check whether your GP's got access to vaccine, because GPs are getting just as much vaccine as the state government is through our clinics. So really look where you can get the vaccine and get vaccinated, because we're going to see more incidents like this where we have the virus coming into our community, and the best way to respond is for people to not get sick because they've been vaccinated. Thank you.
So vigilance is everything. We need Queenslanders, and particularly people who live on the south side of Brisbane, to be doing the right things more than ever before. Make sure social distancing, wearing the masks where required, good hand hygiene. If you're having people at your home, making sure that you are keeping track of who is visiting, and of course getting tested and vaccinated. As Dr. Young, the Premier, has said, this mum took her daughter to get tested simply on a headache. That's what we want to see, no matter how mild your symptoms. If you are unwell in any way whatsoever, don't hesitate. Go out and get tested. That way we know whether we have COVID in our community, and we can act quickly to contain it and protect everybody. And of course we have more clinics opening up on weekends, so please, if you haven't been vaccinated yet, jump online today, register to get vaccinated, have a look at those sites where we do have walk-ins as well this weekend, and also contact your GP or your community pharmacies. And I know many community pharmacies are vaccinating over weekends as well. So take up these opportunities. We've now got 55.4% of our population eligible who have already had one dose, which is fantastic, but we want to see those numbers increase every day. So we're staying really high over 2,300 again, or sorry, 23,000 again. That is fantastic. So we're seeing record numbers of vaccinations, but as the Premier said, more vaccines come in, the more we'll be doing each day. And it was wonderful to open the Cairns Convention Mass Vaccination Centre yesterday. So please, everybody, now is the time to do the right thing, making sure that you are keeping yourself safe, your family and loved ones safe, and check in. We saw what happened the other week when people weren't checking in. It meant delays in being able to contact, trace and isolate people. We can't afford these delays. Sadly, New South Wales has over 150 deaths now and over 33,000 cases. We don't want to be in that position. So check in everywhere you go. It is your responsibility to make sure you're checking in, and to venues, to business owners, please ask your staff to just stop for a moment and check people are checking in before they take their seats or wander around your stores. That way we'll keep everyone safe. Thank you.
Thank you, Premier. So one thing I did do last night, just to protect the most vulnerable in our community, is that I asked all of the aged care facilities, hospitals, disability care services and prisons within the Logan and the South Brisbane areas, so the part of Brisbane City Council south of the river, to limit visitors, except for end-of-life reasons, of course. And I also ask that anyone who lives in those areas to not visit vulnerable settings elsewhere in Queensland. We just need to. We don't quite have enough of all of those sectors fully vaccinated yet to be able to protect them. So just for this outbreak, I've asked that those vulnerable settings limit visitors. Hopefully we can remove that restriction as soon as possible. Thank you.
What else do we know about the New South Wales visitor that was at the father's home?
He stayed there for the one night. So we don't have other information at the moment. We know who he is. So I've been speaking with my colleagues interstate to get him tested urgently.
Do we know whether he was permitted to be in Queensland?
I don't have any of those details. I only got that during the night. So you can imagine we've been doing a lot of interviews through the night with these people.
And he's since travelled
back to New South Wales. Well, I don't know if he's been tested yet. So we've just got to work with New South Wales to get him tested. So I'm not certain, of course, that this is the source, but I think it's the most likely.
And what else are you looking for in the next
we go into a lockdown or not. I guess a lot of people want to know that.
Yeah, so I want lots and lots of testing. I really and truly want people to come out and get tested, because the more testing that's done, the more confident I can be that we don't have virus circulating in our community. So particularly people who live in that part of Brisbane, south of the river, down through to that northern Logan part, I really need you to come forward if you've got any symptoms at all to get tested. Now, we'll organise the testing of close contacts, of course, so that's all of those kids in the school and the people associated with the work areas of the two parents and the people that we've been able to contact at Garden City through QR codes. So people will be receiving text messages about getting tested because their QR code has come up somewhere. So that's really important. But for other people, any symptoms at all get tested. That's critical. Then we will, of course, be doing all of that contact tracing and testing people that we think are potentially at risk of having been infected and seeing what happens there. So the risk is, of course, that we have someone out there who's infected who goes and starts a cluster. So that's what I want to pick up as early as I possibly can. So really, testing's most important. Then people need to protect themselves. We know masks work. So when you're indoors, you really and truly should be wearing a mask unless you're seated and eating and drinking. Otherwise, if you're going to the supermarkets, if you're going to the cinema, if you're going out and about, anywhere you're going indoors, wearing a mask is critical. And outdoors, if you can't socially distance. So you're standing at a bus stop, if you're standing in a queue somewhere to go into somewhere, just have your mask with you at all times so you can put it on. That's critical. So people can protect themselves. Then I also need people to use those QR codes, because as we're seeing now, it's made an enormous difference compared to a year ago, because we can quickly get that information and send out text messages to people. Please go and get tested. So that's really, really important. So please use your QR code. So they're the things that people can do so that we don't need to go into a lockdown. Yes, it does. So you have the 3 children and the mother in one household who are all positive, and the father in a separate household who's positive.
Dr. Youngco, do we know how many close contacts are in quarantine now? Do you have the number on that?
Oh, there's well over 1,000 families from the school, so we'll have well over 1,000 people in quarantine.
And the 2 households, where are they?
One household's in Maruka and the other's in Sunnybank.
Premier, can I just ask, obviously we have no snap lockdown today, but as you mentioned, the next 48 hours are critical. How will Parliament work if we do go into a lockdown? Will you still debate VAD next week?
Look, the Leader of the House, who's also the Health Minister, she'll have discussions with me about that. Look, I'm not going to preempt what will or won't happen, but next week is scheduled to be the debate in the Queensland Parliament of the Voluntary Assisted Dying Bill. Correct. I think what we don't want to see at the moment we've got a lot of people that have gone into like home quarantine, which is great. So we've identified those close contacts, and can I thank our staff, our contact tracing staff, who've been working through the night to keep Queenslanders safe. So great job there. So we'll be looking to see if there's any seeding that's happening outside of those people that are in home quarantine. Yeah. So next 24, 48 hours, Queensland is critical, especially in the southeast. So please mask up going indoors, register, and anyone who has any symptoms whatsoever, please go and get tested. Okay? Thanks everyone, have a lovely day. Thank you. And thanks Mikey. Thank you.